They are more portable and they can be used nearer the patient, if you like, and they are quite rapid in terms of the turnaround time. The idea, I think, is to prioritize these to more remote areas that have less access to the more central laboratories. You know, the procurement side is constantly being updated in terms of how much we can actually get from this particular supplier. So I think that's a dynamic situation. And all I can say is we will get everything that this supplier will be able to provide in the coming months.
This week could mark a turning point in Canada's fight against COVID-19. Health Canada has approved a rapid testing kit made by a Canadian company, Spartan Bioscience. It's a portable device called the Spartan Cube. It's about the size of a coffee cup and can deliver results in less than an hour. The feds have put in an order for 40,000 devices every month. Ontario has ordered almost 1 million of them. Quebec, 200,000, and the Alberta government is in line to receive 100,000. So how exactly does the test work and how could it change the length potentially of this pandemic? Dr. Paul Lem is the founder and CEO of Spartan Bioscience. He joins us not too far away here in Ottawa. Hi, Dr. Lem, good to see you.
Hi, Vashi. Nice to meet you.
Nice to meet you as well. Can I start off just by asking you to describe for us, for our viewers, exactly how your test works?
Yes, so the way it works is you take this swab. That swab goes into this test cartridge. Test cartridge goes into the device, portable DNA analyzer, and then you get your results.
It's that simple.
It truly is that simple.
And how long does it take to get those results?
So this first version we're releasing this week, it'll give results in less than an hour. And then our goal is several weeks from now to release a second version that will give results in about 30 minutes.
What's the genesis of this? Did you see the pandemic unfolding and immediately start to look at a solution, or does this build on something that already existed in a certain way?
It definitely builds on something that already existed. So for 14 years, we've been a world leader in making these portable DNA analyzers. So our customers for other tests include the CDC, New York State Department of Health. And then I'm an infectious disease doctor. And so I've been watching this COVID-19 pandemic around the world for several months. And so then as we saw it spread, we decided to take the CDC's validated test, which they validated on over 2,000 clinical samples, and then put it onto our device.
So what kind of effect do you think this could potentially have? And I ask you, obviously you're behind the test, you know how it works. Your company has a stake in all of this, but I ask you because so many public health officials lately have told us when it comes to the point at which, and this is a while off, but at which those restrictions can start to be relaxed, testing and the testing systems in place in various provinces are what's going to be completely key to that. That's how they're going to be able to relax some of the restrictions. How do you see your test playing into that?
Definitely. So we need more testing capacity, and we especially need more testing capacity for people who live outside the major cities. Because if you're in a city like Toronto, you have access to those central labs with mainframe DNA analyzers. But outside of that, you have to take those swabs, ship it to Toronto, and it can take days or even more than a week to get your results back. And so it's going to be very important to have these portable DNA analyzers in those smaller towns, remote communities, so that everyone has access to fast results.
So tell me a bit about the capacity for your company to provide those tests. The federal government has ordered them, various provinces have ordered them. How many can you supply right now, let's say per week, and how many do you hope to be able to supply in the future?
So we just got Health Canada approval. We're going to be supplying in the order of thousands of tests per week, and that's rapidly going to scale up to hundreds of thousands of tests per week by the summer.
And hundreds of thousands per week?
Exactly, hundreds of thousands per week. So if you multiply that over a year, that's 5 to 10 million tests.
And how? What is necessary, I guess, for that scale up?
So we have all our suppliers. They're now rapidly ramping up, hiring people, creating the molds that actually spit out these plastic parts that go into our cartridges and our swabs.
And I should say to our viewers, because we've talked a lot about testing, and hopefully you can help me distinguish between this, but this is different than the serological tests that have been discussed a lot, particularly in the United States, right?
Exactly. So this serological test, it takes 7 to 10 days or longer for your body to make antibodies to COVID-19. And so you have this period of time where you either get both false positives and false negatives. So those serology tests have to be coupled with these actual diagnostic tests, these molecular-based tests. because you need to figure out, is someone infected right now, and are they infectious to others?
And you mentioned that you're an infectious disease specialist. What do you think the lesson is in all of this when it comes to testing? And what do you think, I guess, as we come out of the first wave, but worry about possible subsequent smaller waves, we should be thinking about?
Well, when you look at countries around the world who have actually successfully controlled COVID-19, you look at a place like South Korea. So two big things they did. They tested a lot of people all the time. The second thing they did was contact tracing. So once they found someone who was infected, then they found out who that person had been in contact with. So I personally think the same thing is going to need to happen in Canada for us to control the pandemic.
Are you worried at all about, I guess, or how might you decide where the tests go? And I ask because so many employers are concerned about how they're going to bring back workers and how they might go about that. I imagine many of them will want to employ this kind of testing. How will it work from your company's perspective?
Yeah, so we've been completely overwhelmed with orders. Canadian corporations, foreign governments, foreign corporations, everyone wants to get access to our supply because there's a global shortage. So what we've decided to do is we decide to, first of all, in the first phase, sell to the federal and provincial governments. They get all our supply. Then the second phase, as we ramp up into the summer, we'll have more supply available. Then it goes to Canadian corporations. And only after we've fulfilled our domestic demand, then we'll start looking outside of Canada.
Okay, I'll leave it there. Thank you, Dr. Lem. Really appreciate your time today.
Thank you, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.